Welcome to the Learning Lab. My name is Roman Garcia. Today we're going to be discussing a condition that's called bow-legged. Now what I'm going to show you is I'm going to show you a case that we did where this bow-legged condition, or these weight-bearing asymmetries that some people are afflicted by, was corrected. And I'm going to describe how it was done. Now there are two ways that you can correct bow-legged. There are differences between both cases. There are money differences, and there are the amount of time that it takes to correct a bow-legged. But the case that I'm going to show you today is the one where biologics was used. Now, biologics is somewhat of a new procedure that's been developed where the patient gets injected with their own tissues. And in the most simplest biologic treatment, that tissue is blood. Now, I brought a sample of blood, and I'm going to show you exactly the component of the blood that's used. Now, Carlos, if you can get close over here. This is a blood sample right here. Now, can you get this, Carlos? This is blood right here. This bottom portion right here, this is the red blood cells. This clear portion up here, that's plasma. Supposedly, it's been proven that this clear substance right here has healing properties to it. Now, in biologics, Carlos, you can come to me. In biologics, the simplest procedure that's performed, this clear material right here of the blood gets separated from this red blood cells right here. And this clear product right here gets injected into the joint. Now, what I'm going to show you, the case I'm going to show you, biologics was used. We used this patient's tissues to prep the knee to where, under the right the environment that was created by using this brace, the DonJoy unloader brace, this person's bow-legged or asymmetrical weight-bearing loads that she was being exposed to was corrected. I'm going to show you, first I'm going to show you a before we did the treatment and a picture of after we did the treatment. The before picture was done in October of last year. The post picture I'm going to show you was taken in April. So approximately 6 months after she finished the protocol. Now, what I'm going to show you first is the pre. This is before we did the biologics, where we introduced the plasma into her knee. We treated the left knee. Now, pay attention to these lines right here. These are the vector weight-bearing lines. We treated the left knee. Now, do you observe, you see how this line right here is down the middle right here? Now observe, this is the right knee, this is the left knee. We treated her left knee. Look at this line right here. This line is real close to the inner part of her knee. This is the inside, this is the outside. She's asymmetrical because this knee was arthritic and was giving her problems. So she was putting all her weight-bearing load on this right knee. So you see how these lines are different. They're crossing the bone in a different plane. This was pre. This was done. This picture was taken in October. She was asymmetrical, or her arthritis was concentrated right here. We introduced the biologics into this knee right here, and then we braced her with the unloader joint, with the unloader knee brace. We put the brace on the left knee. We took weight-bearing load. This system removed the magnitudes of weight-bearing loads off the inner part of this knee right over here, allowing her to develop symmetry between both knees. So here you have the knee before the treatment. You see the weight-bearing loads are asymmetrical. She's putting all her weight on her healthier knee, which was the right one. But you can see the asymmetry here in these weight-bearing vectors right over here. Now, this is the picture 6 months after we put the brace on and we introduced the biologics into her arthritic knee, which was the left one. Now, I'm going to put it side by side. I don't know if you can appreciate this, but I'm going to try and put it here side by side somehow, just like this. This is pre, this is post. Now look, 6 months after we braced her with the unloader brace and the biologics into the left knee. The weight-bearing load, the weight-bearing vector on the treated knee stays the same. But look what happened to the uninvolved knee. The weight-bearing vector has changed completely. It's falling more towards the center now. She started responding symmetrically to the procedure. By the time that we took this picture 6 months later, her symptoms were substantially less. Her function had improved substantially because she became symmetrical from the combination of biologics and the unloader system. Now, this is the issue here though. This biologic treatment is somewhat expensive to perform on the patient. It's not beyond the means of most people, but it is expensive. But it's not the only way that you can correct bow-legged. The main premise of correcting a bow-legged or a knock-knee condition is to prep the tissue. Now, there are many ways you can prep the tissues. We have 2 protocols that we use, those using biologics and those without the biologics. Without the biologics, it takes a longer time because you have to prep the tissue. You have to create pliability in the tissues, and there are means to it. I'm not going to get into how to do it without the biologics, but there is a way to do it. But the one consistent variable that's common to both procedures is the unloader DonJoy brace. Because if you cannot change the weight-bearing magnitude or the way the weight falls on the knee, whether you do biologics or you do without biologics, if you're not able to manipulate the weight-bearing load, you cannot change the weight-bearing vector of the tissue, because the tissues respond to weight-bearing loads, and unless you're able to manipulate that weight-bearing load, then you're not going to get anywhere. So you need to brace the system, and the best system out there, in my experience, is this DonJoy unloader reaction system. Now, I'm going to show you, and I've done this before in the past, but I'm going to show you how to put it on. It's very simple. We've done this before. I'm going to have the help of my assistant, Ana. Ana, te vas a sentar aquí. Now, this is it. We've done this before. The way that this system works is, the way that it unloads is by this bar. Depending on what side you want to unload, if you want to unload the inside, then the hinge will be on one side. If you want to unload the outside, then the hinge will be on the opposite end. Now, this hinge, this system is designed. Now, when the hinge is on the outside, it unloads the inside. When the hinge is on the inside, it unloads the outside. This patient that we reviewed, we unloaded the inside. So the hinge was, just like I'm going to place it on Ana, the hinge was on the outside. Now, in order to put it, it's a very simple system to know how to use. This is the kneecap right here. The only thing that you have to concern yourself with is the kneecap goes right through. That kneecap goes right through that hole. You bring the Velcro straps across the back. You bring the Velcro straps across the back. This is an extra small. This is too small. This is too small for her. She's more of a small. But in essence, this is how it goes. The only thing you gotta concern yourself with is the kneecap goes right through this hole. And that's it. And then you just engage the straps on the back and the system is ready to go. And this is how you put it on. It's very easy. This is an extra small. Ana is more of a small, so it's a little bit tight on her. This would not be the system that I would use on her. But the putting the system on is the same. The only thing you concern yourself with is their kneecap goes right through this hole right here. Okay, siéntate aquí otra vez. Now, like I said, there are two protocols that can be used to correct bow-leggedness or knock knee. The more expensive, faster route to correction is using the biologics, which is, like as I reviewed before, is using the patient's own blood, separating the red blood cells from the plasma, and then introducing this plasma into the joint itself. This will create basically a regenerative stimuli in the tissues. It basically allows the tissues to reconstitute itself. While the tissue is reconstituting itself by changing the weight-bearing dynamics as they fall on the tissues as they are regenerating, you're able to build tissue more on one side versus the other if you're able to manipulate the weight-bearing load, which is the role that this system does. That's the first route. That's how we corrected the weight-bearing asymmetry on this patient that I just showed you. The second route takes longer, but it's much less expensive. And just to summarize how that is done, all you have to do is just introduce energy into the tissue itself. So you're able to establish pliability in the tissues while using the unloader brace. So the common element between both protocols is that unloader brace. If you're not able to correct or manipulate, manipulate is the correct word. If you're not able to manipulate the weight-bearing load as it falls on the tissues, then the result will not be correction of the bow-legged or the knock knee. Now, the second protocol is something that needs to be taught to the individual. The biologics is something that really you just go to a center that practices biologics or regenerative medicine, and if they do not use this unloader brace, and you're not going to be able to correct that bow-legged or the knock knee posture of the knees. The unloader brace has to be a consistent variables as you're trying to correct these deformities. Now, anybody that's watching this video, if you're interested in knowing both protocols, what each protocols entail, and the price point of each protocol, all you have to do is just contact the numbers that are on these videos. If anybody has any questions, if you would like to know a center that practices these protocols, all you have to do is just contact me, send me an email, contact me via any of the phones that are on these videos, and I will gladly speak to you and guide you so you can get the protocol or the procedure to help correct any kind of knee deformities that you may have. Again, for anybody that watches this video, thank you for watching. Until next time.